I'm going to discuss few effective method of breathing, as obviously we all breathe and it's an involuntary action of our body, but we can maximize the effect by following few techniques. So whatever I have in my mind, I would like to discuss it and share it with you all. So for that, it's very important that we are very relaxed, especially our shoulders area, our neck, our jaw, our forehead, our throat should be, so that we can have an easy flow of breath. Along with it, don't have to wear any tight clothing, loose fit is fine, and your stomach should not be full, so at least keep 2 to 3 hours of gap. Early morning is the best time, or the evening when you don't eat anything, and your bladder should not be full, so just empty out your gut and bladder. And then, so let's start with the technique. So whatever I have, I'll just explain as I'm going to perform it along with it. So there are different methods of doing it. So either you can do it standing, or you can sit down on a chair, or you can sit down on the floor in a lotus position or sukhasana, whichever way you feel comfortable. You can lie down on your back as well, so there is no such hard and fast rule. Whichever way you feel comfortable. It's important that your body should be relaxed, and analyze your breathing cycle. So one technique that I follow is, often when we breathe, we without realizing we breathe from our chest. Like when we inhale, we lift our chest up like this, it goes like this, and I don't think this is like a complete deep breathing. I don't feel that the lower sacs of our lungs actually targets or inflate or worked out with this kind of breathing. So I would say deep breathing. When I say deep breathing, one technique which we have to follow is you place your hand on the lower abdomen, little lower than your belly button, and the middle finger is joined very gently like this. So when you inhale, blow, and you feel the expansion. When you exhale, you contract. Okay, you can just focus. So you have to inhale deep through the diaphragm, hit through it, and feel the expansion on the stomach area. Okay, this is one way. Second, you can keep one hand on the front and keep one hand at the back like this. Okay, so you should feel the expansion when you inhale, only these areas. Okay, so you can keep your eyes closed, body is relaxed, don't clench your jaw, throat, everything at ease, and so I can feel my lower abdomen bloating, and I can feel my back as well expanding. Okay, third way, you can probably hold it like this from the sides. You should feel like the fish gills expansion. So as you inhale, lateral breathing, literally. But you have noticed when I'm inhaling, my chest is not rising up and down. So target is here. Obviously we are not breathing from our abdomen, but when we imagine that way, we target the lower sacs. So same way, in Pilates, this is called lateral breathing. So I'll go sideways on my knees. You can go down on your child pose, Balasana, and you can stay in this position, or you can stretch your arm. You can keep your arms here or at the back, or you can take support. And now you do this deep breathing. So when you inhale, you should feel your lower back and the sides inflating, not the chest. Okay? So deep inhale. Exhale. So this is also very, very effective. You can lie down on your back or your stomach like this. Okay, body absolutely relaxed. Turn your head on one side, and you can pull only like this, and you can do this deep breathing. Inhale. So when you inhale, I've mentioned in many other exercise routine also that you when you inhale you can count of 4 of inhale and you can hold it for 4 seconds and then exhale for 4 count and hold it for 4 seconds. Same way you can increase it like a count of 6, inhaling, hold for 2 seconds or 4 seconds, 10 seconds. So there are different techniques to improve your lung power. So this should be the basics before we progress to a pranayama practice, because if we don't breathe effectively, it's of no use. So we have to engage the entire breathing lung rather than only shallow breathing. So one more technique is like you can it's a segmental. So we imagine we'll first breathe from here, second from our stomach, third from the chest, fourth from the clavicle. Okay, so we go like this. So we start with, it's in one shot. So we inhale, try to fill up our lower abdomen first, slowly till the abdomen in one breath, then to the chest, and then till the clavicle. And you go down like this. So it will go. So you can make out, you can literally feel the expansion at the bottom, you can feel the stretch. So this is another technique of. So after this, slowly and gradually you will progress to pranayama, few of them. But effectively, this is one thing we should start practicing, as we don't realize, we don't breathe effectively at times. And if we can follow some of these techniques, probably we'll be able to make our breathing technique and our lung power much better. Thank you so much.